Do people with migraine headaches have an increased risk of Alzheimer's disease? A question I was asked by a follower yesterday. So I thought I'll put out a video. Hopefully people will benefit from it. So the answer to this question, unfortunately, yes, people with migraine headaches have increased risk of Alzheimer's disease. There are several studies that have indicated that. One of the studies is the largest studies in South Korea, which showed that the incidence of Alzheimer's disease in the general population typically 4 in 1,000. Now, the incidence of Alzheimer's disease in migraine patients came out to be 8 in 1,000. So there was an increase of Alzheimer's disease in patients with migraine headaches. Also, the study showed several things too. The risk was higher in younger individuals, younger than age 65 versus older than 65. The risk was higher in patients with chronic migraine headaches rather than episodic migraine. And the risk was also higher in people with higher BMI or obesity. So at the end, yes, the risk of Alzheimer's disease is higher in migraine headaches. However, it increases in people with chronic migraine and with people with obesity. Now, why does this happen? Nobody knows. It could be that migraine headaches affect the memory centers in the brain. It could be the effect of the medication. It could be the negative effect of migraine headaches on the brain. But it's not very well established to why migraine headaches increase the risk of Alzheimer's disease. What does that mean to me as a patient with migraine headaches? Probably not much. What I would suggest is that if you have migraine headaches, keep them under control, because if you have episodic migraine and you don't have a chronic migraine, then the risk is lower. Also, if you have control your weight, if you have a higher BMI or obesity, that increases the risk. So if I control my weight, that would help too. And finally, and I'll put out a video about it, that you can look, if you have a higher risk of Alzheimer's, try to do things that will lower your risk of Alzheimer's and prevent Alzheimer's or help prevent Alzheimer's if possible. All of those can lower the risk of you having Alzheimer's. But the most important thing is controlling your migraines, controlling your weight. That would lessen the risk of Alzheimer's if you have migraine headaches. Thank you.